Welcome back. We are here with Dr. Jason Levy, chiropractic physician, here with Atlantic Health, home of Atlantic Sports Health, and also a chiropractor to the New York Jets. I want to talk about this system that's been relatively new. I mean, the research around fascia. We talked a lot about over the years myofascia, but fascia itself, this collagen matrix that envelopes our full body, envelopes muscle groups, organs, groups of muscles, fascia chains, this collagen matrix that gets tight and layered over injury. You are a certified ART specialist, active release technique, which is a modality or expertise in breaking up myofascia or fascia specifically. Talk to us about your experience here in terms of working on the fascia system and what happens with an injury and why it's important not to, once you get injured, to be stationary or stiff, or why we get people moving right away post-surgery. Talk to us about that.
Yeah, it's a great point, and a lot of people don't realize that that fascia does basically go over the entire body, all the muscles, all the organs, and basically due to training, now you could develop injuries to the fascia. You could have repetitive stress injuries. You could have trauma to the muscles or soft tissues, and also due to hypoxia and different reasons, surgery, as you mentioned as well. There are lots of reasons that fascia can get kind of have changes in it, and the fascia covers all the muscles, and a lot of people just think of muscles when they think of soft tissue injuries, but there's really no way to injure a muscle without injuring the fascia, and because they're interconnected.
Yeah.
So, people who come to us, and you don't even have to be an athlete to have issues with your muscle or your fascia, of course. Right. Sitting in front of a computer all day with your head forward and your body slumped is going to affect the fascia and the muscles of your body as well.
Yeah. What's interesting, to give you a better picture of fascia and what it is, if you could imagine and you cut open a grapefruit and you squeezed out all the juice, kind of all that webbing inside, what's left of the grapefruit is really the fascia, right?
Sure.
And all the juice and all the pulp, if you will, would be the muscle fiber,
yeah.
Right? And that's what we're learning now from science, and now we have really advanced equipment that can look at the human body live and look at fascia and how it's developed and woven into the muscle cells, individual cells through individual units, and all the organs and how it wraps. And it also looks like or seems like it's a cellophane wrapping.
Sure.
So if you think of cellophane, you kind of put your sandwich in that cellophane wrap. It's that clear plastic. Well, we have that throughout our entire body, and it's really what gives us our integrity,
Sure.
to give the muscles and the organs. It holds everything together. Without fascia, we would just kind of, not be able to stand up. It would just fall apart. I mean, we just don't have the structural integrity without fascia, and there's different types of fascia. So it's a connective tissue. It's a collagen matrix that's created by a cell called fibroblasts, and it's really quite amazing how this is such a new science. And I know you're on the cutting edge, helping athletes recover from more fascia buildup than they really need in terms of maybe, like you said, overuse injuries. So what has been some examples that you've done or you've had with athletes where you've made some breakthroughs?
Yeah, I mean, the thing with, as you mentioned earlier, that I am certified in active release techniques, and chiropractors, physical therapists, athletic trainers, massage therapists, people who get their hands on patients and athletes, we're feeling for tissue texture, tissue tension. I like to use the analogy of a steak, because patients say, well, what are you feeling for? I say, well, we want kind of medium rare, but what? And I say, if we blindfolded you, what would well done feel like? Tough and taut and fibrous, and so that's kind of the feel, and that's what we're looking for, and we're trying to kind of tenderize that tissue, that steak, to make it a little more medium rare.
That is a great analogy. That's the first time I heard that one. I love analogies about fascia, the grapefruit, but feeling, and people can almost kind of feel themselves, and there's a lot of myofascial release technique people can do upon themselves, such as foam rolling or trigger point technology. Obviously, having a professional like you feel around and help go right to the hot spot, we
Sure.
call it, right?
Oh, yeah.
These trigger points. But the steak analogy, absolutely, yeah. We want to be medium rare, right?
Supple.
Yeah, we want to be supple, not well done. And if we're well done, we've got something going on with that tissue, right?
No question.
It needs some treatment. It needs some work. Vibration training now is big. We got these now vibrating foam rollers that
Sure.
play a big role. So really great stuff. Thanks so much for the insight, for the analogy. Guys, look into this area. Myofascial release, ART, Dr. Levy, really important stuff. Make sure you're evaluating your athletes to get rid of these challenged areas, these trigger points, these issues of toughness, because those ultimately lead to injury.
Sure.